Something feels wrong down there. You noticed it this morning. A little burning, an itch you can't ignore. And you sit there for a second, doing the thing everyone does, which is hoping it just goes away on its own.
Here's the problem. It's the 1100s. There's no pharmacy. There's no internet to check your symptoms on. There's no friend you can text who say, "Oh yeah, that happened to me too. Here's what worked." There's just you and whatever you can figure out on your own, and a village full of people who might treat you differently if they find out what's wrong.
You, watching this right now, you'd walk into a store, grab a box off a shelf, and be done with this in 3 days. She doesn't get that. She might not get better for weeks. She might not know if it's going to kill her. So let's actually sit in it with her. Let's see if you'd make it through.
The first thing you'd try is a wash, not water. A mix of garlic, wine, vinegar, sometimes olive oil, stirred together and used the same way you'd use anything today, hoping it cleans the problem out. And this isn't some one-off desperate idea somebody made up in a panic. Women in Egypt were doing this exact thing thousands of years before you were even born. It got passed down generation after generation, mother to daughter, because it was genuinely the best anyone had.
And here's the strange part. It kind of, sort of worked. Vinegar and wine are a little acidic, and it turns out your body down there is supposed to be a little acidic too, to keep the bad stuff away. So without knowing anything about bacteria, without a single microscope in the entire world, she accidentally stumbled onto something that was actually true. Not because anyone understood why, just because it was the thing that was around, and it happened to help a little. But not every remedy out there was that lucky. Go back a little further, to Egypt, and the actual medical writing from that time lists other things women used for problems like this. Crocodile dung, mixed with honey and sour milk, written down seriously in a real medical document, meant to be taken seriously by real doctors. We're not telling you to try that one. We're telling you it existed. It was real. And somewhere out there, a woman was desperate enough or trusting enough to actually use it. But here's where you actually catch a break. Because if this happened to you in the 1100s, there was one woman on the entire planet you'd want walking through that door. Her name was Trota, from a city called Salerno in Italy, and people call her history's first real gynecologist. She wrote an entire book about women's bodies at a time when almost nobody was writing anything like that at all. Her actual advice, in her own words, for pain like this, take rose oil and use it right where it hurts. That's it. Short, direct, no fear, no shame in how she said it. And it turns out rose oil really does fight off a little bit of bacteria. She had no way of knowing that. She just knew it seemed to help her patients, so she kept using it, and she wrote it down so other women could use it too. Quick side note, because it tells you everything about how blind medicine still was. You know the red and white striped pole outside old barber shops? That's not random. Barbers used to double as surgeons. The red stood for blood. The white stood for bandages. Because back then, if you were sick with almost anything, including this, someone might just cut you open a little and let you bleed, and call that the treatment. That's the level of understanding you're working with here. A woman like Trota quietly getting things half right with rose oil was the exception, not the rule. And there's a darker layer underneath all of this too. Back then, a lot of people genuinely believed women were supposed to suffer through problems like this, that it was punishment, going all the way back to the story of Eve in the Bible, that the pain wasn't a problem to be fixed. It was something you'd earned just for being born a woman. Trota didn't buy any of that. She treated her patients like their pain actually mattered. Warm cloths, chamomile baths, real comfort, in a world that mostly told women to just endure it. If you were lucky enough to end up in her care, you were doing better than almost anyone else in Europe for centuries after she died. But Trota wasn't everywhere. She was one woman in one city. For almost everybody else, you were on your own, or leaning on whatever your mother told you, or the healer 2 villages over, or just what you'd overheard once. Nobody could tell you what was actually wrong. Nobody could tell you if it would pass in a week, or if it would come back every single month for the rest of your life. You just had to wait and hope and try not to think about it too much.
And here's where this whole thing gets almost insulting, because you think, okay, eventually somebody figures it out, right? Science catches up. In 1667, someone actually built a microscope good enough to see germs, real, tiny, living things moving around under the glass. Actually seen, actually real.
And it took another 210 years before anyone connected those germs to actually causing disease. 210 years of just staring at proof and not putting it together. So if you survived your infection in the 1100s, your granddaughter's granddaughter's granddaughter would still be treating the exact same problem the exact same blind way 500-600 years later. Nothing had really changed at all.
So could you actually survive it? Probably. Most of these infections won't kill you on their own. But surviving isn't the same thing as it being okay. Surviving still means weeks of discomfort, still means not knowing, still means it might come back next month, and the month after that, for the rest of your life, with nobody able to tell you why.
Now, here's the part that should actually land for you. This isn't just some old-timey story that has nothing to do with your life. The CDC says about 75 out of every 100 women today will deal with this exact kind of infection at least once, most of them more than once. This didn't stop happening. It's still happening right now to someone you probably know.
The difference isn't that the problem disappeared. The difference is what happens next. You get a same-day trip to the store and something that actually works. Because in 1877, someone finally proved germs cause disease. And medicine finally had something to aim at. She just had rose oil and vinegar and hope. And honestly, what we're covering in the next one might be even harder to sit with than this. Don't miss it. So here's what we actually want to know. Has a doctor ever gotten something wrong about you at first, before someone finally listened? Because if 700 years wasn't enough time to fully fix that problem, we're genuinely curious how long it took for you.